On this World Pneumonia Day, we're helping to spread awareness with these 5 quick key facts about the infection. Number 1, there is no one cause for pneumonia. Pneumonia is an infection of the lungs caused by different germs, including viruses, fungi, and bacteria. Symptoms include fever, shortness of breath, cough, chills, and a general feeling of weakness. Number 2, anyone can get pneumonia, but some are at a higher risk than others. Infants and children under 5 years, people over 65 years, and individuals with pre-existing illnesses such as heart disease, HIV, and asthma are most vulnerable to the infection. Number 3, sadly, pneumonia can be deadly, especially in young children. It can first show up mimicking cold or flu-like symptoms, then get progressively worse. Millions of people are hospitalized each year with the infection, and it's one of the leading causes of death in children. Number 4, research shows that breastfeeding for the first 6 months helps to prevent children from getting pneumonia. Breast milk makes the immune system stronger, and so it's encouraged to help the baby fight off infections, including those that cause pneumonia. And finally, number 5, pneumonia can be treated with antibiotics and usually gets better in 2 weeks. It's important to remember to practice good hygiene, exercise, eat healthy, and get adequate rest, so just in case you do get sick, your immune system can withstand the pressure and you can recover fast. Those are your 5 fast facts on pneumonia. Don't forget, keep safe, stay healthy, and do regular checkups. Your health is your wealth.
All right, that was an introduction to the current affairs topic on the table, what you need to know about pneumonia and children. So earlier, we mentioned that today is recognized as World Pneumonia Day, and with the flu season in full effect, we wanted to take some time and examine this infection, which many of us are vulnerable to at this time. Look who's reading. Joining us for the discussion, and she had an interesting article in the All Woman, is pediatrician Dr. Anona Griffith. Good morning.
Morning.
Welcome to Smile Jamaica. It's morning time.
Thank you very
One
much.
of the interesting things that was said in the article, Doc, is that people often misdiagnose pneumonia.
Well,
It says you pay close attention to the symptoms that your child presents because you may be misdiagnosing a more serious condition, such as pneumonia.
so that was on the background that oftentimes pneumonia might start off, or it often starts off as what we call, looks like a common cold. You may have a runny nose to begin with. You may have a slight fever, but we have a tendency in our culture to watch things. But if you have a fever persisting for 2 days, you are having respiratory tract symptoms, meaning a cough that's not going. Also, if you're having symptoms of a runny nose, and a child who's just not looking well, that's not something that you want to sit and watch. That's something that you want to take action. Even though you may be giving what we call fever medicine, cold or cough medicine, which is oftentimes what we give, bush tea, honey, and garlic. If you're finding that it's not working, you need to seek medical attention. And there are persons in our population who have other conditions such as asthma, sickle cell disease, who are susceptible to pneumonia. And for them, their course tends to be very dramatic, and it can be very serious for them. And so quick action has to be taken. So you really don't want to mistake it and have somebody, a layman, misdiagnose and say, oh, it's just a flu. You get over it, and then it deteriorates into something that's worse.
But even some doctors will tell you to watch it for 3 days. If your child has a fever and then come in, that's like a standard response, no? You're saying...
For some, it's a standard response, but if you know your child and you know that there are certain underlying things and your child is not looking better and you're not seeing the kind of improvement that you want to see, it is in your best interest to move.
Especially if that fever is over a certain...
If it's over 100, 102,
Yeah.
if it's mild, 99 is not a fever, categorically. It usually is 100 and above. But if you are having niggling thoughts and you are having doubts, why not move?
Yeah, gotcha. Delia, in our intro, said that it's flu season. We're talking about pneumonia, and you are at pains when you came on the set to say the two are not linked. they're different things?
It's not that they're not linked. The flu is a virus. Pneumonia is usually referred to what we call bacterial infections of the lung.
Okay.
But one,
Can
as
you-
in the viral illness, can be associated with a bacterial illness as well. So you don't want to take it lightly that just because it's the flu symptoms that it can be serious. And we know that historically over the last 5-10 years, influenza and its family members, I'll just say because there are other viruses, including influenza and parainfluenza, that has caused and wreaked significant havoc in our population and has caused even deaths. So it's not something to be taken lightly. It's just that the two are two different organisms and the presentation may be different initially, but they end up with the same kind of symptomatology and the process that occurs in the lung can actually be very similar and very life-threatening as well.
All right. How is it diagnosed? I'm seeing here it says it may be made based on the history of the condition as well as examination findings.
So it's a combination of things. As doctors, this is the mantra of the basics and foundations of what we're taught. Everything is based on a good history, a physical examination. X-rays and diagnostics imaging are supplemental. They're essential, but they're supplemental to the information that you will get. So you'll sit in a doctor's office and be asked questions. It's not people fasting in your business. It's to get the information so you'll be able to decipher whether it's A, B, or C, or something else that's sinister that you wouldn't have assumed that it is. So a history is very important. So being very precise in identifying the time, the duration, the frequency, that's very important for us to get information. What medications you have been using, what has been working, what has not been working, the use of alternative medications or alternative methods of management. Those things are very important for us. If there is a family history of certain conditions, if there is an underlying chronic illness, such as HIV, is something that many of our children have. Sickle cell disease, notoriously associated with certain pneumonias. So asthma, another condition. We're in dengue season. We're finding lots of children with respiratory symptoms as a result of the sequelae. So it's important to get information. Following that, it's not usually one thing that's a sign. It's a combination of factors that will allow us to say this may be pneumonia versus not. You're looking at presence of a fever, presence of what we call sniffles, runny nose, presence of shortness of breath, of people say you're blowing short. Talk about moving, the muscles in between the ribs. We talk about breathing faster than usual, or even after going through a period of breathing very fast, starting to slow down with your breathing, showing that your body is not compensating anymore for, because the body is natural in its defenses. It tries to compensate, it tries to fight. But it gets to a point where it cannot fight, so it starts to show signs and symptoms. If you're having a cough that's productive, meaning that you're getting up, sputum, cold is coming up, and the color is changing from that of a clear initially to white, into colored, into brown, those are signs that you are getting into a period of some amount of problem, difficulty that needs medical attention.
You advise, Doc, that protection against this is possible. Much of it has to do with proper hygiene and lifestyle choices.
Right. So as we all know and we'll read many times, viruses, which are the most common agents that cause pneumonias, are usually spread by droplet infection. Droplet has to do with people in your space. So the more crowded your space, the more air is going to be breathed and exchanged between people. So one person having an infection is going to pass on to the other person. The other thing, washing of hands. We all do things, different things with our hands. We interact with different organisms and agents that are not clean. If we don't wash our hands, we're going to pass it on. Habits that children have, the picking of the nose. Some of the agents that are bacterial tend to be colonized in the nostrils. They tend to pick the nose. They also do what we don't like them to do, put that hand in the mouth.
Yeah, they eat it.
Right.
Yeah.
Right.
Yeah.
Right.
Breastfeeding?
Breastfeeding. So breastfeeding is very important because what that does is mommy has some nice immune antibodies that she passes on through her milk to baby, and that does offer some primary protection to baby, especially your babies who have not yet been immunized. So there is some protection from breast milk, and a mommy who continues to breastfeed offers her baby not only comfort, not only care, but also essential nutrients such as proteins and some amount of vitamins and immunoantibodies that will help to protect baby.
How important is vaccination?
Okay,
In the fight against pneumonia?
vaccination is very important. There is an organism that used to be, still is, but not as much as before. It's called Haemophilus influenza. It's different from influenza virus, and that was notorious for causing, especially bacterial pneumonias. Since its inception and its introduction into the immunization schedule, the incidence of Haemophilus influenza causing bacterial pneumonias has decreased. However, it has a compadre called strep pneumonia.
Oh, strep. Anything is not good.
Strep pneumonia that has now come to light. So you lose one, you gain another. Strep pneumonia has also a history of causing severe pneumonias. Now that we have identified that as a prominent cause, and we've had studies in Jamaica that have shown that as a prominent cause of pneumonias, we have also introduced that into our immunization schedule. So you find that there are certain members of our society who we have been advocating for, and provision has been made to facilitate those patients. Sickle cell disease is one of them. Patients who have Down syndrome, patients who are premature, patients who have other chronic illnesses, or babies who have had to be on ventilatory support for long periods. We advocate for them getting their pneumococcal vaccines. That's not to say that the whole population shouldn't get it.
Right.
It should be administered to the population. As you get older, the number of doses decrease, other than the primary series, but even to have one dose on board is very important for your protection.
Okay. We have to go, Doc. What I hear you saying is,
Give us
parents,
a-
watch your children, look at what's different with them,
Yep.
get them to the hospital or to the doctor quickly if you see a change. If you see a change in them,
Correct.
advocate for them to wash their hands.
Please.
Docs, if they're sick, you may not want to send them to school.
That's right, because it's spread in their
Right.
own little environment.
Okay.
And this is reason why flu season is even so more prominent now, is because school time.
Yeah.
They get it at school, they take it home.
Yeah, man, they share. Trust me,
Lord.
it's a lot of
Very
sharing.
kind.
Son, give in.
Yeah. No sharing here.
Sharing is
I
caring.
don't want hers.
Dr. Nona Griffith, pediatrician, really giving us all you need to know about pneumonia.
Yeah.
And everyone, I wouldn't just say children. It wouldn't be Tuesday without Girl Talk. What does it truly mean to be single? We're going to talk about it on the other side of this break. Don't go anywhere. We'll be right back.
Don't go anywhere.